Great morning, everybody. What a wonderful day in Manitoba. The weather's great, the leaves are falling, and the weather is positive. I'm very much enjoying the time we have here today, and thank you for joining. My name is Paul Provo. I'm president of 6P Marketing and chair of the Manitoba Chambers of Commerce Board of Directors. On behalf of Chuck, MCC president and CEO, welcome to today's webinar, Asked and Answered, Q&A with the experts. I'd like to start by acknowledging the Indigenous peoples of the lands that we are on today. While we're on a virtual platform, we can take a moment to acknowledge the importance of the lands which we each call home. We do this to reaffirm our commitment and responsibility to improving relationships between nations and to improving our own understanding of local Indigenous peoples and their cultures. As our neighboring provinces surge into the fourth wave of COVID-19, many of us are feeling the pandemic fatigue and maybe even nervousness about Manitoba's immediate future. In spite of our almost 80% full vaccination rate, our K-12 kids are back in class learning, and many of us are returning to the workplace after 18 months of working remotely. Meanwhile, we've recently learned about third dose recommendations for vulnerable Manitobans. We've been reading about highly transmissible Delta and Mu variants and hearing stories from COVID long haulers. We're wading through complicated ethical issues related to immunization, considering accommodations and testing options. And yes, we're still talking about practicing the fundamentals. And that's why we're here today. We need to understand what safety looks like, and as business leaders, what we should be considering to protect our staff and keep clients safe. If you've been following COVID news, you've likely heard from today's special guest, Winnipeg-based epidemiologist Cynthia Carr. As the founder of Epi Research, Cynthia is celebrating 20 years in business supporting empowerment and data collection, problem solving using the principles of epidemiology. She is an expert in the identification and interpretation of data and develops data collection tools that are sustainable for ongoing monitoring and planning. Cynthia works with clients to develop evaluation plans to assess the effectiveness of policies and programs and measure return on investment. A primary focus of Epi Research is Indigenous, Northern, and rural equity in health outcomes and access to health services. And Cynthia is the only self-employed epidemiologist who travels to communities and works directly with leadership, service providers, and community members. We're honored to have Cynthia here with us this morning. Before I pass it over to her, though, for the formal presentation, I'd like to acknowledge today's sponsors, whose support enables us to deliver high-quality events like these at no cost to our participants. First, special thanks to Pipblado, a leading Manitoba-based law firm rooted in 135 years of history. Pipblado's 63 lawyers provide clients with exceptional counsel and solutions in 21 practice areas, from corporate and commercial law to labor and employment, Indigenous, intellectual property, mergers and acquisitions, and more. Also, special thank you to the Bioscience Association Manitoba, BAM, whose mandate is to enable commercial success for Manitoba's bioscience companies by acting as a catalyst for innovation. BAM's 110 plus members come from all sectors of the bioscience ecosystem, including medical device, manufacturers, pharmaceutical and biopharmaceutical companies, agricultural and industrial biotechnology, clean tech, and more. I'd like to thank participants who submitted questions in advance. If you didn't have an opportunity to submit a question or a new question arises for you during Cynthia's presentation, please feel free to put it in the Q&A panel at the bottom of the Zoom screen. Chuck will work hard to get through as many as he can, but if we can't get to your question due to time constraints, we'll forward them to Cynthia to collect answers. We will also be recording the session and emailing a link to all registrants. Now let's get a couple of quick poll questions. Your responses are anonymous and the data are collected in aggregate form only. The first question should pop up on your screen. Simply select a corresponding answer and we'll receive a snapshot of results. Does your organization have a vaccination policy? All right, thank you very much. It's interesting to see a bit of a split here. Yes, being the prevalent one, which is a good thing. I'm sure, hopefully Cynthia will talk a little bit about this. And now for a second poll question. Is your organization providing workplace accommodations for employees who choose not to be vaccinated? Perfect. Thank you again for contributing to these quick poll questions. The responses will help us get a sense of what's happening in our business community, and I'm sure will help guide Cynthia in her presentation. All right, Cynthia, the floor is yours. Take it away, please.
Good morning and thank you. I'm just going to share my screen now. So that we can get started. You know, there's a whole lot of things that we could cover today. Obviously, we could spend a day or two in a workshop, and you know, I have about half an hour of time to give you some information and then try to respond to as many questions as I can, and certainly will do so. So basically, you know, there's a vast array of things that we could talk about. Each topic could take a day. We could talk specifically about point of care testing and what those options might be for employers, mandates, implications, human right implications, so many things that, you know, I'd be happy to discuss with you. Just a caveat. I'm not a doctor, I'm not a lawyer, I'm not a human rights specialist, and I'm not a human resources specialist. However, as an epidemiologist with a policy background, what I can do is work with you, and have done, to talk about key aspects. What is the risk in your workplace setting? How might I be able to help you identify what risk means in your workplace? Do you still need a contact tracing plan for your own workplace and notification plan? What are some optimal settings to have in place for that, to make that go smoothly and quickly, whether it's in the school, in a construction site, or other area? Every individual workplace has its own risks, and beyond the public health contact tracing, you need your own strategies as well. When you're looking at your you know, ongoing safe return to work policies, what do those look like? What does it mean overall? How can you incorporate a policy that looks at influenza season, to other issues beyond just this pandemic? How do you keep on top of ever evolving changes? And if you are looking at mandates or other policies, of course, you know, you're looking at perhaps pressure from unions or employees. How can I help you perhaps make sure you've done your due diligence and said, you know, the decisions we made were at the point in time, the best scientifically valid peer-reviewed data that were available. And I can also help you determine, how do you best involve staff as we move forward? How do you meaningfully engage? Understand from them what they've been through, what they need going forward, what were some risks that they would identify for you, and how do you kind of keep that process going as we move forward? So, you know, this pandemic has been really difficult, obviously. And unfortunately, part of that is they're unpredictable. You know, we can say, you know, it could happen, it will happen. We know for sure that they will occur. The problem is that we don't know when. So how do we keep that vigilance up? How do we keep that investment in planning and preparedness? Because it's really hard for government to justify that ongoing investment in public health when you don't see that immediate outcome, immediate reward. And sometimes businesses can think that way too. I don't want to spend money on things that might not happen. But the earlier we put plans in place, make sure they're continually updated, achievable, that we have the resources in place to react quickly, the better off we are in the long run. So, you know, the World Health Organization has said this all along, and in every pandemic management plan, all three areas are contemplated. So it, as you know, as businesses, the impact is well beyond the physical health of people. The economic well-being and social well-being of people have been enormously impacted. And in fact, if you ask people, how many of you know somebody that have been infected with COVID-19, typically the number that would say yes to that are far smaller than if you ask about, do you know or have you experienced impact to your own mental health, to your own business, to your own economic situation. So we always have to kind of acknowledge that the challenge for government is that juggling constantly about the physical health and safety. How do we deal with economic well-being? How do we deal with social well-being? We're used to, at least in my field of epidemiology, having those social determinants of health as the driver. My focus with community and business is how do we empower businesses, get people thriving, educated, employed, and the health outcomes will be better for those populations. In a pandemic situation, although we're looking at those three areas constantly, that physical health and infectivity will always trump. So when we look at, what have we been through since December 2019 till now, just a bit of a timeline here from when that first case was identified, or at least we knew about it, on New Year's Eve, December 2019, until kind of where we are at now. Our first case in data in Canada being March 9th, in Manitoba, March 12th, our first death just over 2 weeks later. And then, of course, the variants of concern and their impact on the cases and on our strategies, and how we have gone from feeling safe to not safe, and all of the inundation of headlines that we've been faced with from what is this? We need to move fast. How many people is this going to kill? What does it look like in the hospitals, in the labs, in community? What exactly is this virus? What does it look like? What are all those spikes on the outside? And then again, that hope of when is the vaccine coming? When is the vaccine coming? Is something that we kept looking forward to and asking when, and it's a little bit surprising to many of us that there's still some hesitancy against, what has been the great hope. So, we can look at, when we talk about or think about roller coaster of emotions, this has been our situation in Manitoba. This an early situation, those numbers seemed so high at the time. And then in the summer, we felt like we were safe. Then we had that exponential increase in the fall of 2020, really difficult, couldn't get together with families for Christmas, work together, brought those numbers down. But then again, the variants of concern are coming in. Delta comes in right around here. And boom, even though we've got the vaccination going on, our cases go up again. We make new policies, we continue our process with vaccination, bringing it down and seeing just a little bit of increase. So again, just that ongoing up and down, even just in the last few months, we see this, kind of waffling of cases, not really being clear what the trends are, how to react. And then this just shows again, the impact on deaths. And we know that, the highly vulnerable population that experience most deaths being our elderly and those with other health conditions, and why it was so important to focus there with our vaccination efforts to bring those deaths down. Because again, the clinical trials about the vaccine was not about preventing spread, it was about preventing serious illness, which of course would lead to mortality. We have not, though, as a province, had the same experiences. And that's why there's been ongoing challenges and discussions, some might say arguments, about why should we have a targeted approach? Why should we have a universal approach to Manitoba when different areas of the province are at different situations? But the reality is, we're an interconnected society. If we weren't, we wouldn't be in a pandemic globally. So although we've had areas where some regions seem safe, and in many ways it would be ideal to have targeted approaches, going forward, our focus has to be continue as much consistency as possible, and again focusing on the uptake of vaccine, because we've only got 70 new cases as of yesterday. We still know that number can escalate quickly, and we're up to almost 60,000 cases experienced in Manitoba, with about 600 active cases today. Here's where we stand in Canada in terms of active cases as of yesterday, and we sure don't